Today we are going to discuss about idiopathic respiratory distress syndrome, also called neonatal respiratory distress syndrome, or respiratory distress syndrome of newborn, or hyaline membrane disease. The pathophysiology includes surfactant deficiency or abnormality, pulmonary hypoperfusion due to hypoxia. Etiology, it is more predisposed in, that is, we can see the respiratory distress syndrome commonly in cesarean birth, diabetic mother, child of diabetic mother, maternal bleeding, premature birth, prenatal asphyxia, prolonged labor or rapid labor, second born twin or siblings with idiopathic respiratory distress syndrome, or Caucasian males. It is a image which shows a pathophysiology, that is decreased pulmonary surfactant, which eventually leads to atelectasis, which leads to decreased lung complaints, which led to decreased alveolar ventilation, which leads to decreased alveolar tension, which eventually leads to refractory vasoconstriction. By pulmonary vasoconstriction, what happens? The blood bypasses the lungs via fetal pathways. The lung hypoperfusion occurs, lung ischemia occurs, lung metabolism will be reduced. As a result of the decrease in pulmonary surfactant, what happens? Atelectasis occurs. Atelectasis, as a result of atelectasis, lung compliance decreases, alveolar ventilation decreases, alveolar oxygen tension decreases, reflex pulmonary vasoconstriction occurs, blood passes through fetal pathway, lung hypoperfusion occurs, fetal lung ischemia occurs, lung metabolism. This shows an X-ray image of idiopathic respiratory distress syndrome. Clinical signs of respiratory syndrome we can see in a child with this symptom, and ABG values show hypoxemia, hypercapnia, and respiratory acidosis. Hypercapnia means increase of CO2 level. Symptoms within the first 8 hours of life. First symptoms will appear at the first 8 hours of life, peak usually by third day. Ground glass appearance of the chest X-ray will occur. Ground glass appearance. Management include antenatal glucocorticoids, corticoids, that is steroids. We know we will administer dexamethasone or betamethasone for a preterm labor. If it's planned elective LSCs, or if it is emergency LSCs also, we can administer. Surfactant replacement therapy, we can give empiric antibiotic therapy, thermoregulation, avoid hypoxemia and acidosis. That is, we have to keep the oxygen level 50 to 70 mmHg, optimize the fluid management, reduce the metabolic demands, minimize lung injury. Or CPAP we can use, VT 4 to 5 ml per kg we can use, PEEP we can use. This is a surfactant function exogenous surfactant we giving due endotracheal to we are inserting without surfactant and with surfactant. We can see the difference. So we have discussed about idiopathic respiratory distress syndrome. It is also called try to remember, it's also called neonatal respiratory distress syndrome of newborn, hyaline membrane disease. Pathophysiology includes surfactant deficiency of abnormality, pulmonary hypoperfusion due to hypoxia. It is more commonly seen in cesarean birth, diabetic mother, maternal bleeding, premature birth, prenatal asphyxia, prolonged labor or rapid labor, second born twin or sibling with idiopathic respiratory distress syndrome, Caucasian males. We can as a result of decreasing of the pulmonary surfactant, it leads to atelectasis, which eventually leads to lung compliance, decrease in alveolar ventilation and alveolar oxygen tension, and reflex pulmonary vasoconstriction, bypasses lung hypoperfusion, lung ischemia, lung metabolism. Presentation we can see respiratory distress sign. What are the signs of respiratory distress? Nasal flaring, chest decrease in the rise. That is the symptoms we can see. Ground glass episodes, chest X-ray. down glass appearance of chest X-ray. Management: antenatal corticosteroids, surfactant replacement therapy, empiric antibiotic therapy, thermoregulation, avoid hypoxemia and acidosis, PO2 50 to 70 mmHg, optimize fluid management, reduce metabolic demands, minimize lung injury. These are, here is the end of the document. So let's pause, let's stop this topic